Good morning, everyone. My name is Tony Maritato. I'm a licensed physical therapist here in Middletown, Ohio. The name of my practice is Total Therapy Solutions. And today I'm going to be sharing my patient education presentation for anyone who's planning on having a total knee replacement surgery. Now, I'm going to be using the Johns Hopkins Medicine's patient education pamphlet. I'll make this available to you so you can download it in the description below this video, or it's publicly available online if you just go to their website. So they've done a great job in putting everything together in a very nice, neat, organized fashion. I'm just going to kind of run through some of the pages initially, and then I'll provide added feedback on my experience as a physical therapist. So first, what is arthritis? Simply put, arthritis could be considered degenerative changes throughout the joint. There's different kinds of arthritis. There's osteoarthritis, rheumatoid arthritis. There's over 50 different varieties. If you go to the Arthritis Foundation website, they simply define it as pain and stiffness around a joint. For most patients who are having a total knee replacement, the arthritis is osteoarthritis, which is a degenerative change in the cartilage that covers the bone. So looking at the total knee replacement specifically, what happens in this procedure is they remove the ends of the femur and the tibia, and I'll show you pictures of those bones shortly. They replace it with a component, a prosthetic. Different surgeons will use different materials, and that now becomes the knee replacement. So effectively, the cartilage that was affected by the arthritis is no longer in place, and you have new material in there that's smooth and designed to work the way your old knee used to function. So, of course, there's always major risk factors. This is a major surgical procedure. You will be under anesthesia. Some patients will require blood transfusions. It's important that you approach this as you would any major surgery. There's risks associated with any major surgery, anything from infection to cardiac events. There's concerns with, reactions to the implants or the material. So you want to make sure that you've spoken to your surgeon beforehand. But it's important that you understand the surgical team you're working with is going to do everything within their ability to keep you safe and make this as pleasurable of an experience as possible. So every surgeon, every surgical team is going to have their own approach to anesthesia. You want to talk to your surgeon. Here is the information from Johns Hopkins. So several factors that they're going to be considering include past experience with surgeries. I know that when my wife goes under anesthesia, it takes her longer to respond to the medication than other patients. So she's had to wait or talk and communicate with the anesthesiologist to let him know, hey, I'm not ready for this yet. I can still move my legs, kind of thing. So everybody's going to be a little different. If you've never had surgery before, just keep the lines of communication open. Your physical and mental and emotional and spiritual health are going to be part of this procedure. Of course, there's always possible reactions or allergies, risks of every type when you go under anesthesia. And you want to understand the preferences of your surgical team. Johns Hopkins, which I love the idea, recommends selecting a coach, someone who's going to help you through the joint replacement process. Now, it could be a physical therapist, it could be a family member, it could be somebody from the surgical team, but you want somebody in your corner, somebody you can go to that you trust, that you feel comfortable with, that you can give them a list of questions so that when you forget the questions you need answers to, they're going to be there to help you along the way. You also want somebody who has experience to answer questions related to what has happened to other people that have had the same procedure. Now, most surgeries are preceded by a class on joint replacement. It could be a combined hip and knee replacement class. It could be dedicated to knee replacements. If your surgeon teaches the class, offers the class, go ahead and do it. I'm providing this video as a service because I know a lot of people didn't have access to a pre-surgical class. So the common question is, how long am I going to stay in the hospital? And I can tell you that many patients have this procedure done on an outpatient basis. They don't spend any time in the hospital. It's done in a surgical center. For more complicated cases, for higher risk procedures, they might have you go to the hospital. You might spend a night, depending on how you recover, depending on what time of day the procedure is being done. But again, that's going to be a question very specific to your surgeon and your surgical team. Let's talk about what to do up to 4 weeks prior to surgery. Now, I personally, as a physical therapist, like my clients to start preparing even sooner. I like a 3-month, a 90-day window to get ready for surgery. I know that's not always practical. It's not always possible, but when it is, I really want my clients spending a full 3 months working on multiple aspects so that the recovery from the procedure is as easy as possible. But in this case, they're going to talk about 4 weeks. So medical and anesthesia clearance. You have to talk to your primary care. You have to talk to your current medical team. If you have other medications, if you have any potential cardiac concerns or breathing issues or dizziness or anything like that, you want to get all of that resolved, and you want clearance from all of your other medical providers before you go in for the surgery. I would suggest you get that clearance before you even schedule the surgery, because sometimes if you don't have that clearance, it's going to delay the surgery and cause more problems. Any of your lab testing should be done well in advance of the procedure. These days with COVID, you want to make sure that you have your testing done based on what your surgeon is requiring. If you can go to a joint class in person, if you can get a chance to see what your surgical team recommends, go ahead and do it. If not, hopefully you gain some value from this class on YouTube. Topics that are typically discussed in the class, and we're going to kind of touch on through these videos, what to expect on the day of surgery. Now, every surgical experience is going to be different. So you want to know what your surgeon and their surgical team is going to provide you on the day of surgery. You want to know what's going to happen during your procedure and during your hospital stay, should you stay overnight. You want to talk about pain management and understand what they're going to do during the surgery, but more importantly, after the surgery. I know a lot of patients who get prescribed 1 or 2 medications. Maybe those medications don't work or they cause nausea and vomiting. You can switch medications, but you have to be able to communicate that with the surgical team. You want to know if there's going to be any equipment that you're going to need. In the US, most patients after a total knee replacement will receive a standard walker. In Europe and other countries, they'll use crutches, but you might have a continuous passive range of motion machine issued to you. You might not. You might have an ICE recirculating machine issued to you. You might not. There are multiple pieces of equipment that some surgeons use and some do not. So you want to have an idea of what to expect. An overview of the nursing care, what nursing is going to do, how they're going to follow up with you to make sure the incision and the wound is being dressed properly. You want to have your occupational therapy and physical therapy set up ahead of time. Most of the patients, once they go to outpatient therapy, they don't even consider occupational therapy. I'm a physical therapist, but I would tell you and encourage you to really consider also working with occupational therapists. It's covered by Medicare Benefit Policy Manual and most other non-Medicare plans, and an occupational therapist will absolutely deliver value in a different way than a physical therapist. I would want as much help as I can get, and if your insurance is willing to cover it, it's absolutely worth your time. And then, of course, an overview of the discharge plan, and this is going to be stuff like, when are you going to be discharged? How are you going to get home? What's going on for getting you from the car to the house? Are there any barriers in the way? Do you have stairs or a ramp, or what assistance are you going to have at home? Is somebody going to be staying you for the first 24 to 72 hours? All of that information is going to be important, and you want to have a battle plan in place so that you can have the peace of mind of knowing I'm going into this procedure as ready as I can possibly be. Insurance coverage is a big one. We want to know, is the insurance going to cover the procedure, but not just that? What is the insurance coverage for the anesthesia? There have been stories of patients where the surgeon is covered by insurance, but anesthesia is not. We want to know what happens if something turns bad and you need to stay in the hospital or you need to be transferred to a skilled nursing, what is the insurance coverage for these different scenarios? Because there's nothing worse than trying to recover following a major surgery like a knee replacement, and then all of a sudden getting bombarded with insurance bills and medical bills that you had no idea to even expect. Exercise. So obviously this is my forte as a physical therapist. Every surgeon is going to have their biases. They're going to want you to do certain exercises, but there are some standard exercises that are almost universal. You can see here, this individual is doing what's called a short arc quad. I've got videos on my YouTube channel showing you how to do that. But basically, you know, he's laying on his back. He's got a bolster under the knee. He's tightening the quadricep, the front of the thigh, to straighten the knee and then relax it back down. Of course, keep in mind, this individual looks incredibly fit and does not look like he just had a knee replacement. Your short arc quad is not going to look like this photo, but that's okay. Some side lying exercises to strengthen the hips and the glutes and the lateral musculature around the leg. All of these are great exercises. Heel slides are a universal exercise that almost everybody's going to do. Then we've got some long arc quads. This is where you're sitting and you're extending the leg, very similar to the first exercise, just in a different position. You know, heel slides in a seated position versus in a supine or laying position. Heel raises to get some muscle action down in the lower leg for the ankle and the calf. I can tell you that many of the patients I see after a total knee replacement not only have the pain from the surgery, but they also have pain in the calf muscle and in the thigh muscle. The calf is usually because of the decreased activity and swelling that accumulates in the lower leg. The thigh muscle pain is usually when the surgeon is using a tourniquet. Not all surgeons use a tourniquet, but some do to manage blood loss. In the process, it also causes some pretty significant soreness in the thigh muscle, the quadricep, IT band, hamstring. A couple other exercises, and I'm not going to spend too much time because I've got a whole list of videos for you. Standing knee flexion, which is working the hamstring, the muscle behind the thigh. Mini squats, but I would tell you, do not do it holding onto a chair like this because that chair is not stable. It will absolutely tip on you. Standing marching in place, side leg raises, like these are all great exercises to perform within the first week or two following surgery. A quick note, so dental requirements. Once again, I'm going to advise you, ask the question if you have a cleaning scheduled or if you have any major dental work that needs to be done, try to do it before surgery. Try to give yourself a 6-month window after surgery. But there is still much debate on whether antibiotics are required prior to dental procedures. Some say yes, some say no. I've looked at the clinical research. I'm going to say, do your research and make your decision, or talk to your surgeon to figure out what they want to do for this. But the best case scenario is get all of your dental work done before you go in for your knee replacement surgery. And then, of course, general healthy habits, right? We want to take this opportunity. We're having a major surgery. We want to get into the best possible shape we have been physically, mentally, emotionally, spiritually. We want to eat as much healthy, whole foods as we can. There is no perfect diet. We see people who respond well to all kinds of recommendations. But generally speaking, I think it's safe to say decreased processed food, decreased added sugar, increase whole foods, whether they be cooked or raw, whether they be vegetables, fruits, meats, grains, whatever it is that your research tells you is best for you. But I'm going to say that 90 days prior through 90 days post, we want those 6 months to be the best 6 months you can have. And so part of that is going to be eating the best food, the most nutritious food, and just trying to change those lifestyle habits that kind of have maybe been declining over the last 10, 15, 20 years. So before we go into the next section, I'm going to end the video right here because I want to spend some time on talking about the transport from the hospital or surgical center to your home, talking about preparing your home for when you return to the hospital, and kind of the next stage in the procedure. You guys are always welcome to ask me any questions at any time. You're always welcome to post them in the comments down below, and I'll see you when I come back for the next recording.